Hello there. I am hopping on a little bit early, earlier than my 5:15 time, to join you all on Wednesday evening to chat again about one of my favorite topics, which is functional neurologic disorders. And I particularly, I'm going to say hello to Dania. Hi, Dania. I am particularly excited to talk to you tonight about something that recently was published that I have really loved, and I feel like, hey, Emily's here too. Hi, Emily. I feel like every healthcare provider needs this article, and I want to review and highlight a few things. And if you're interested in it, I send out a review of everything that we're learning at Re+active and all the videos from the week to people that are a part of our newsletter. So if you're interested in this, I'll send a link in there. There is a link in our bio on Instagram to sign up for our newsletter too, but it's just reactiveeducation.com/newsletter. Every week, all the videos, all the resources going into there. And this particular article, I think was shared just last week by one of my favorite people in the world of FND, and that's John Stone. He's in the UK, and he was part of a group, so led by Karina Bennett here, that wrote a lovely, lovely review that, again, came out this year, 2021. It's called A Practical Review of Functional Neurologic Disorder for the General Physician. But I would argue for any healthcare provider. Very practical, succinct, to the point, gives great little details for you if you're new to functional neurologic disorder. So I want to highlight a few key pieces for you, and then you'll have to join our newsletter and grab the article. It's great. So I also would say, send this to the physicians that you work with. Send it to other healthcare providers. Send it to psychologists or psychiatrists that maybe don't know functional neurologic disorder. Part of my personal mission is that people would understand this disorder, and I know that is the mission of this group out of the UK led by John Stone, is to get the word out, because one of the things that they mentioned in the article is how many times people go to multiple healthcare providers and physicians, and the person doesn't understand the diagnosis and can actually make it worse. And we'll talk a little bit about it. So I want to talk about, I'm not going to read the whole article to you, but there's some really great points to it that I wanted to highlight. And the first is how common functional neurologic disorders actually are. And this has been brought up in the literature a lot, but they're very common. And in this, they talk about them being at least 5 to 10% of all new neurologic consultations. That's pretty common. So similar to something like MS, for example. Also, in talking about who does this occur for, it's all ages, all genders. It can really occur across the spectrum. I worked with an 11-year-old, for example, this morning. And so it's not isolated to one group of people. And one of the things that they point out in this article, which I thought was really, really helpful, is that in the medical world, there is a fear about misdiagnosis. And they mentioned this, a study. So they did a large cohort study. It was over 1,000 people. And they found within that group that only 4 people were misdiagnosed with FND who ended up later having something else. I want to say hey to Leanna. Thank you for joining us, joining me tonight. Great to see you. So it's not commonly misdiagnosed, and that's something that in the medical world people can be fearful to give the diagnosis, but it's not commonly misdiagnosed. However, there are a lot of things that go wrong in the diagnostic process of a functional neurologic disorder. And the article really nicely goes through what not to do and how to communicate and how to assess, and I'll highlight a couple of those. But one thing that's really nice, so again, if you're new to functional neurologic disorders, I highly recommend this, is they actually talk through the different types. So functional limb weakness, tremor, dystonia, and other abnormal movements. So this is one of the pitfalls of diagnosis, is to see an abnormal movement and go, oh, that's a functional neurologic disorder because it's kind of weird. Well, no, there's many other things that are also kind of weird. So really important to pinpoint down in the clinical exam what positive findings match up to a functional neurologic disorder. So the article really nicely goes through some of those positive findings, like a positive Hoover sign, highly reliable. Similar to the Hoover sign would be a hip abduction test, highly reliable for functional weakness. The entrainment test of tremor, where you look to see if the tremor trains to another rhythm of movement, highly reliable for a functional tremor. It goes through some of the different presentations of functional dystonia with nice little pictures as well. So there's typical presentations of a functional facial dystonia, also typical presentations of fixed dystonia. So fixed dystonia is not very common in idiopathic dystonia, is more indicative of a functional dystonia. This is something, by the way, I learned a lot of this from the amazing Alan Wu. He's a movement disorder specialist at Northwestern now. He was at UCLA, and he talks through really nicely the differential diagnosis of functional movement disorders and dystonia and other movement disorders. He's joining us again, by the way, for our Cultivating Central Nervous System Connectivity course, our functional neurologic disorders course, which we are going to have in person in October. I'm so excited, and Dr. Wu is going to be a part of that. Anyway, that was a little sidebar, but that differential diagnosis part is really important. Another really interesting finding that I read in this study was about functional cognitive symptoms. So again, highly recommend this article, but they go through functional limb weakness, tremor, dystonia, also the functional seizures and how those present, but functional cognitive symptoms. This was really interesting. I had not read it before, but a recent review said that 24% of people attending memory clinics may actually have functional cognitive disorders. So did you know that that was a thing? Did you know how common it was? I think actually as people are learning more and better making these diagnoses, we're going to see some of these numbers go up even more. So they talk about functional cognitive disorders. They talk about irritable bowel syndrome, urinary retention, two other pieces that can be highly correlated with other diagnoses, but also can be functional and have a strong autonomic component. So that's something that, again, we look at for all of this. So moving through, so I'm just giving you the highlights from this article because I just really loved it so much. They move through some of the new understanding of pathophysiology, which I love to talk about, of course, and then treatment. And this is what I think is so important. So especially if you're a PT or an OT, tune in from the treatment standpoint. The treatment evidence is growing in this area by leaps and bounds. And one thing that they so nicely point out here is that traditional therapy of how we might retrain movement may actually cause symptoms to worsen. And here is why. So traditionally, let's say we might be working with somebody post-stroke, and they may have a particular gait characteristic. Let's say they're circumducting their leg. Well, we bring attention to the limb and we have them pay attention and modify their movement behavior. Well, if you did that in a functional movement disorder, as you bring attention to the movement and the limb, it actually worsens the symptoms. That's part of the diagnosis. That's part of the definition of the functional movement disorder or neurologic disorder, is that attention intensifies the symptoms. So what we would typically do in therapy is going to be counterproductive, and in fact, it's likely going to make somebody worse. So don't do it. What you do instead is bring awareness and attention away from the body, away from the symptom, and to the automatic movements. So, for example, I'll give you an example from today. I was working with somebody who could not stand up. And when we just brought attention to it, like stand up, it was painful, it was difficult, could not activate the muscles. However, when we made a game out of moving the legs, when we brought attention away from the limb and body parts, so we had an external focus, we had different targets, and we were sitting, we were standing, we were touching, and we were, by the end, actually leaping, like jumping over multiple targets. So from going to not being able to stand to jumping over multiple targets. Was this person faking it? Were they putting on a show? No, they did not have access to that movement with attention on the body part in the movement. They had access to automatic movements. Now, we also did some autonomic training. We did a bunch of other things, but the moral of the story is when you bring the awareness away from the body and to an automatic motion with external focus, for example, you can unlock that movement pattern. And that is one of the biggest sources of success. This goes not just for movement, this goes for other symptoms, dizziness, pain, etc. When we can take the attention away from that, we open up the possibilities of the brain to function and send those signals like it's supposed to, which is in a very automatic, goal-directed way. So I'm so appreciative of this non-PT article talking through the pitfalls of traditional physical therapy in functional neurologic disorders. So the traditional approach doesn't work. Unlock automatic movement absolutely works, and it's so powerful. So really, again, I'm going to give you the name of the article, but again, sign up for our newsletter and I'll send this out as a resource. It's called A Practical Review of Functional Neurologic Disorder for the General Physician. It's in Clinical Medicine 2021. Karina Bennett is the first author on it. Excellent. I'm going to send it to all my physician friends. Every physician, every healthcare provider should know this basic information on functional neurologic disorders. And honestly, I think we'll have a lot more people out there not experiencing the kind of things that they typically experience with a healthcare provider, which is getting worse. So join our newsletter, get it, and stay tuned, by the way, because our functional neurologic disorder weekend course, a full weekend, we're doing it in person, yay! And we're doing it online for those people that can't travel or can't come in person. By the way, we're only going to have 15 people in person. So if you want to join us in person, sign up for it. But it's our weekend, all functional neurologic disorder course. It's in October 1st and 2nd. And we can't wait. We can't wait to do it. It sells out every year. And actually, this is a real new take on it. We've done a similar course talking about multiple disorders, but this is going to be all functional neurologic disorders all the time, a whole weekend course. And it's going to be on Saturday and Sunday, October 1st and 2nd. I put a link in our bio because, of course, there's an early bird special of $100 off for that course. And I'm really excited. This is with myself, Brittany Kim, Alan Wu from Northwestern, Laura Ettinger, who's a chronic pain specialist here in Los Angeles as well. The four of us get together. We have a great time, and we're talking all functional neurologic disorders. So diving in a lot deeper than the basics that every healthcare professional should know. But start here. Absolutely. Start here with the basics and then keep diving deeper. Thanks so much for joining me tonight. And on Friday, I'm going to actually highlight some of the treatment and pathophysiology pieces that they share in this article as well. So we're going to dive deeper on our Facebook page. You can join us there 12:30 on Friday. Thanks so much. Have a great evening.